Assalamu alaikum wa rahmatullahi wa barakatuh. Hello everyone. This is our introduction to the nursing program. You're now in the preparatory year, so congratulations on your acceptance in the MdcB Medical College. As you know, MdcB Medical College is a leading college in medical education in the Middle East. Nursing program is glad to be a part of your excited journey. We understand that this could be a confusing time for you to choose the most suitable medical profession that suits you. That's why we are gladly participating in the Introduction to Health Profession course to enlighten you about what nursing is all about. Nursing program head of department and all faculty wishes you all the best of luck in your future studies. In our presentation and discussion today, we will cover a couple of objectives. We will discuss together development of your broad understanding of the diverse range of health professions. You will gain insight into the roles, responsibilities, and scope of practice of nursing profession, exploring educational pathways, prerequisites, requirements, and continuing education opportunities for the nursing profession, understand the interprofessional collaboration necessary for comprehensive patient care, understanding the importance of nursing as a profession in the medical field, get an insight about international and national nursing statistics, discover the extent of professional nursing ethics, recognize the variety of healthcare settings for nurses, discover modern nursing practices and trends, and then we will conclude. And if you have any questions, you can ask me and email me. This is me, Ms. Maha Ibrahim. I have a bachelor's degree in nursing from King Abdulaziz University. Also, I have a master's degree in medical education. I was employed in MdcB Medical College in nursing program since 2019 in Jeddah branch. I'm a lecturer nowadays in the nursing program. This is my email, as I told you. If you have any questions, feel free to email me. Okay, I want to start our presentation by asking you an important question. Why do you think it's important that you learn and know about the healthcare professionals? Why you study about nursing? Why you take a course about medicine, dentistry, and all the other medical professions? Yes, that's right. As I mentioned before, this time might be confusing for you to decide which medical profession you want to study in your future studies. So, knowing a little more about each and every medical or healthcare profession will give you this clue. You will find that these professional objectives attaching your own personal objectives. So the most important thing that you'll be passionate about what you choose. And the specialty that you're going to study is the specialty that you like and love. Okay, in our presentation today, I'll try to mix some English with some Arabic. And we will start by talking about nursing department in MdcB Medical College. Okay. So, the bachelor degree of nursing in MdcB Medical College, as you know, this college is designed to prepare graduates with a proper amount of knowledge, skills, and attitude in order to face the challenging dynamics in healthcare services. The vision and main objectives of the nursing program at BMC is to provide high-quality nursing education, to provide Saudi Arabia with qualified and competent nurses and researchers who are able to provide a diverse healthcare and take leadership roles that are necessary for the improvement of the health and quality of life of the community. Nursing program structure. Here you're going to have an insight about what you're going to study exactly if you are specialized as a nurse. So the first year, this year that you are in now, this is the start of your journey, the preparatory year. you will study, as you know, some of the general courses like English studies, chemistry, biology, physics, computer science, Islamics, medical ethics, and medical terminology, biochemistry, and a combine of general courses. Then, when you advance to your second year and you chose to study nursing, so it will be your first year in nursing program. في سنة أولى من مرحلة التمريض you will study some of the fundamentals courses. We have fundamentals of nursing course, we have health assessment course, we have communications and human relations course. The communication and human relations course is very important, as we will mention also, to help you learn some of the soft skills. You also are going to study in your first year of nursing human growth and development, professional nursing ethics, nutrition, anatomy, physiology, pathology, microbiology, and parasitology. As you're going to complete studying some of the general courses that you didn't finish in your prep year. In your second year in the nursing, it will be your third year overall. You will find yourself studying more about specialized area in nursing, such as adult medical surgical nursing, maternity and gynecology nursing, pediatric nursing, pharmacology, psychosocial aspects. We have some of elective courses you may choose from, such as nursing informatics, health counseling, and epidemiology. In your fourth year, that's your third year nursing, if you're following. Nursing, you're gonna study more specific nursing courses, such as psychiatric and mental health, nursing management and leadership. You will also study about community health nursing, geriatric nursing, critical and emergency care nursing. You will also here in this year study a scientific nursing research, also a course of health education. Your fifth year, which is your final year overall, and your fourth year in the nursing program. This year we call it internship year. What do you do in internship year? You're going to be exposed entirely in the clinical area and deployed in clinical settings and hospitals to be prepared to be an employee in the future. Okay, after this, you're going to be completed 100% of your nursing studies and now able to register yourself as registered nurse. Moving along, we will discuss the importance of nursing education, why it's important to study nursing. The minimum preparation for being a professional practice is to get a bachelor degree in nursing education. And MdcB Medical College offers that. Today, bachelor's program provide education for both basic students who have preparing for the licensures and those who are registered nurses before. So if you have your nursing diploma and you want to upgrade your certificate into a bachelor certificate, you can come to the MdcB Medical College and do your bridging program. Also, it's important to study nursing because a variety of economy, educational, and professional trends are fueling the demand for registered nurses with advanced degree. There are changes in the healthcare system, requires the nurse to proceed increasing knowledge, clinical competencies, and greater independence and autonomy in the clinical judgments. There's trends toward community-based nursing centers, private care management, complexity of home care, increasing sophisticated technologies, and society's orientation to health and self-care are rapidly rising the educational needs for nurses. Nurses who have advanced education can become researchers, nurse practitioners, clinical specialists, educators, and administrators. They can achieve higher status, professional growth, knowledge and skills of autonomy in practice, increasing self-esteem and a sense of personal achievement as a result of the additional education that's futuring and strengthen their profession. So we always encourage you to pursue higher education. When you graduate from nursing, it's not the end of the educational road for you. You should seek a higher education in master's degree and PhD degrees. That's how you can advance yourself and increase your resume and be more powerful in your field. You can become researchers, as we mentioned, and take leadership roles and make and be in the decision-making panel of nursing in your country. Nursing qualifications: bachelor degree for accredited college. That's your first step, which you are in the right place. Batarji Medical College is an accredited college. A nursing program is also an accredited program. So when you finish this first step, then you are in your first step of being a qualified nurse. Second step, get your licensure examination. To be a registered nurse, you have to take the CNLE. It's the Saudi National Licensure Examination. You get to do that while you're while you were in your internship year. And then when you pass the SNLE exam, you can be a registered nurse. You start your first employee journey as a clinical instructor if you choose to be in academic field, and as a registered nurse if you choose to be in the clinical field. If you get a higher education, you can get master's degree. After you finish your master's degree, you can get your PhD degree. So, the current trends and the future trends and future needs for the nursing program in KSA and worldwide. Nursing career is very important, and it's a big demand on nurses, male and female nurses worldwide. There's a keep increasing demand, especially after COVID-19, and there's always a demand for nurses in the healthcare sectors. There's a critical need for qualified nurses in all of the world's countries. So in 2014, the World Health Organization reported a global shortage of 9 million nurses and midwives around the world. This is how much we need nurses. According to the World Health Organization, there are 19.3 million nurses worldwide. Nurses represent the largest proportion of the health workforce as a total of 50%. However, according to the studies, in order to achieve the universal goal of 2030, a future 9 million nurses are needed globally. So nurses here, they are now covering 50% of the work field and healthcare professionals force, but we need more nurses. By 2030, we need more nurses to be affiliated in healthcare system. Now I'm going to specify our nursing need to our Kingdom of Saudi Arabia. So Saudi Arabia is challenged by nurse shortage as many other countries. In response to that, the government forces on increasing the number of qualified manpower who can meet the needs of the healthcare services and population. Various governmental and private nursing programs were established in various regions to supply the market with qualified nurses. However, despite the development in nursing education and profession, still the Saudi market is in demand of recruiting more qualified nurses. Now you find some of the colleges that make affiliations, scholarships in nursing programs to increase the nursing professions. we still need more nurses, as we said before. What do you know about nursing? Now we're gonna discuss the specific roles and responsibilities for nurse. Nursing is a healthcare profession that focuses on the care of individuals and their families to help them recover from illness and maintain optimal health and quality of life. التمريض ما يركز فقط على إنه يشيل أوجاع الناس أو يساعد الناس إنها تتعافى أو يصيروا أصحاء. لا، الممرض أو الممرضة يهتموا بالشخص كجزئية كاملة، قسم عن الأوجاع الجسدية، وقسم عن المشاعر والأحاسيس، وقسم الروحانيات. فهم they view the person as a whole: physical needs, spiritual needs, and emotional and psychological needs. ودائما التمريض يكون هدفه الأساسي إنه يرتقي بجودة الحياة لدى الناس ولدى المرضى. That's what we mean by the optimal health and quality of life. تاني حاجة، nurses are distinct from other healthcare providers as they have a wide scope of practice and approaches to medical care. They play an integral role in promoting health, preventing illness, and caring for all individuals, including those who are disabled or are physically or mentally ill. التمريض يشوف الفرد كجزء من المجتمع، والمجتمع ما يتعافى إلا بتعافي الأفراد. فالتمريض من أهم التخصصات الصحية اللي تدقق في حياة الفرد وتخليه وتسعى إن هو يكون بأحسن صورة وأحسن طاقة صحية عشان يفيد المجتمع. Nurses advocate for the best interests of their patients at all times and focus on holistic health, which encompasses the physical, social, emotional, and spiritual needs of the patients. They are also involved in the treatment decision-making process to represent the patient's situation and make recommendations. الممرض أو الممرضة مو بس يلعبوا دور التمريض، لا، هو كمان يلعب دور محامي الدفاع عن مرضاه، ودائما يسعى إنه يوصل لأفضل أو لمصلحة المريض القصوى في حياته على جميع الأصعدة زي ما ذكرنا، على physical, social, emotional and spiritual needs of the patients. وكمان الممرض يشارك في القرارات الصحية والقرارات المصيرية للمريض، لأنه هو زي ما قلنا محامي الدفاع عن مرضاه. لما نبغى نتكلم عن some of the nursing roles and responsibilities، حأقول إنه الممرض are responsible for the ongoing care of the sick individuals that need to assess their health status and help them throughout the process to recovery. بيساعد طبعا الممرض والممرضة بيساعدوا المرضى إن هم يتجاوزوا مرحلة العلاج ويوصلوا إلى مرحلة التعافي بأفضل طريقة ممكنة. الممرض والممرضة دائما بيشاركوا الفرد والمجتمع بأنهم هم بيعملوا promoting للhealth، promote health and prevent illness، يعملوا توعية صحية ويمنعوا الأمراض قد ما يقدروا بالإجراءات الوقائية. care for the disabled and physically or mentally ill people، بيعالجوا وبيهتموا بالأشخاص اللي عندهم أمراض جسدية وكمان عندهم أمراض عقلية. engage in healthcare teaching، بيعلموا وبينشروا التوعية الصحية بين أفراد المجتمع. participate in the provision of healthcare alongside other team members، الممرض والممرضة هم جزء فعال من الفريق الطبي المتكامل. وزي ما احنا بندرس في هذا الكورس أهمية التعاون ما بين الهيلث كير وركرز والعاملين في مجال القطاعات الصحية، طبيب جنب الممرض، جنب الصيدلي، جنب معالج العلاج الطبيعي، جنب المعالج التنفسي، كلهم يشتغلوا as a team واحد، يعني فريق واحد، إنهم يقدموا أفضل خدمة صحية للمريض. supervise training and education of nurses، الممرض أو الممرضة لو مسكوا مناصب إدارية حيشرفوا على تدريب وتعليم الممرضين. assist in healthcare research. بعدين كمان لما يوصل من مراحل متقدمة من تعليمه هو الشخصي فيكون يشترك في البحوث العلمية اللي تفيد القطاعات الصحية وتفيد التمريض. المهارات اللي مطلوب من الممرض أو الممرضة إنهم هم يتعلموها. If we're going to talk about nursing skills, they are divided into two categories. متقسمة إلى 3 مجموعات. Basic skills مهارات مبدئية، advanced skills مهارات متطورة، والsoft skills. المهارات البيزك اللي المريض أو الممرض أو الممرضة لازم يكونوا يعرفوها زي مثلا patient history taking, physical assessment, vital signs, bed making, bed bath, medication administration, inserting intravenous access, nasogastric tube feeding. زي مثلا من المهارات الأساسية اللي المفروض الممرض أو الممرضة يتعلموها ويكونوا متمرسين في أدائها كيف ياخذوا الميديكال هيستوري أو التاريخ المرضي للمريض، كيف يعملوا له physical assessment أو فحص مبدئي، كيف ياخذوا علاماته الحيوية. وإذا نبغى نذكر العلامات الحيوية هي ضغط المريض، عدد نبضات القلب، عدد مرات التنفس في الدقيقة الواحدة، حرارته. طيب كمان ممكن يعرف كيف يرتب سرير المريض ويساعده إنه هو maintain his hygiene level، كيف يعمل يدي الأدوية للمريض بالطريقة الصحيحة، كيف يدخل الحبل الوريدي أو المدخل الوريدي. Some of the advanced skills إذا بتكلم عن المهارات المتطورة للممرضة والممرضة: how to do electrocardiogram, tracheostomy suctioning, ventilation care, PICC line insertion, CPR or cardiovascular resuscitation, cardiopulmonary resuscitation, chest tube care, wound dressing and blood transfusion. هذه المهارات يمارسها غالبا في أقسام الرعاية الصحية الحرجة أو العناية الحرجة أو intensive care units. وبعد كده السوفت سكيلز هي المهارات الناعمة، هي مهارات التواصل communication skills، كيف يعمل دعم معنوي للمرضى emotional support، كيف يقدم التعليم للمرضى ويوصلها بأبسط الطرق للمرضى patient education، كيف يدعم كمان مو بس المريض، يدعم العائلة حقت المريض family reassurance. الwork categories مهمة ليش؟ لأنه each one of us they found or you will find comfort in working with a certain age category. Maybe you like to work with babies and infants. Maybe you want to, if you are a female nurse, you want to work exclusively with women patients. Maybe you like elderly patients and you want to work in units that serves elderly patients. That's why the work category is important. If you like to deal with infants, your work departments, the most suitable for you would be nursery or the NICU, the neonatal intensive care unit. If you like to work with older children, so you might work in pediatric clinics or pediatric ICU or the pediatric wards. If you like to work exclusively with women or female patients, you might work in obstetric or gynecology wards, delivery rooms, the obstetric clinics, or the infertility clinics. If you like to work with adults, it's the most common units like medical ward or surgical wards or the operation room. You may go to emergency department, psychiatric unit, endoscopy, ICU, CCU. The ICU is the intensive care unit. It's general. The CCU is more specified intensive care units. It's specialized for the cardiac care unit or oncology unit. If you like to work with older patients, geriatric wards, intensive care units, or the palliative care department. Now I will tell you about statistics about nurses in Saudi Arabia. So, the salary range for nurses in Saudi Arabia, there's an average salary for Saudi nurses range around 14,200 Saudi Riyal per month. Salaries range from 10,000 to 14,000. As much as you gain more clinical experience, more years, higher education, and more qualification, your salary will range in a higher average. These statistics were taken from the website of Salary Explorer 2020. So minimum salaries range from 10,400 per month. Average salary 14,200 per month. Maximum salary might reach to 20,100 per month. If you want to compare salary between Saudi Arabia, different cities, you will find the highest paid is in the city of Riyadh. Then you will find Jeddah in the second place. Mecca, so close to Jeddah. Medina, closer range. Dammam, also a close range. Why you study interprofessional collaboration? Why you take this course and know about each and every health profession? Because as I mentioned before, الفريق الطبي هو تيم، هو فريق، ولازم حتى الممرض يشتغل في هذا الفريق كعضو ما يتجزأ. هو الفريق كامل ما يتجزأوا عن بعض. زي هذه الحلقة اللي انتم شايفينها قدامكم، كل جزء مرتبط بالجزء اللي بعده. في الانتربروفيشنال كولابوريشن في ترندز بتطلع في القطاعات الصحية والنظام الصحي الجديد، زي patient centered care. يعني ايش patient centered care؟ يعني لازم الممرض والممرضة والفريق الصحي كامل يحطوا المريض في وسط هذه الحلقة اللي انتم شايفينها، والكل يشتغل لما فيه مصلحة المريض وليس المصالح الشخصية والفردية للفريق. تاني حاجة، في ترند جديد في عالم القطاعات الصحية اسمه patient experience أو تجربة المريض. صارت القطاعات الصحية والنظام الصحي يهتم بتجربة المريض من أول ما يدخل على المستشفى أو القطاع الصحي أو المركز الرعاية الأولية لين ما يخرج منها، ويقيموا تجربته من كل النواحي، من الاستقبال للتنويم لتنظيم المواعيد لخدمة الصيدلية لخدمة المساعدات. بعد كده في البيشنتس رايت وحقوق المرضى. المريض عنده حقوق زي ما أنت كممارس صحي عندك حقوق لازم تلبى جميعها في القطاعات الصحية. والهيلث كير سيرفيسز والخدمات الصحية لازم تكون مجهزة ومعتمدة من الأكريديتيشنز بورد الداخلية والخارجية، وعاملة أقصى المعايير المتقدمة في الرعاية الصحية. If I want to talk about the interprofessional collaboration, I will start with the patient-centered care. Patient-centered care is that you put your patient as a healthcare team, not as you only as a nurse, no. A whole healthcare team professionals must put your patients in the center of your care. And you all work together to provide patients' best interests. You have to include your patients in the decision-making regarding his treatment plans and make him involved in every step of the way. Take his preferences, relate to his background and cultural background, relate to his previous and current experience. There's also a patient experience, which is a very a trend module nowadays in the healthcare division and systems. They care about patient's experience from the time he log into the hospital to the time he is dismissed or discharged. Patient experience is important to facilitate his treatment journey as smooth as possible. From the time, as I said, he log in, they care about his um, appointments arrangements, if he's going to be admitted to the hospital, administration and registration procedures and protocol. His inpatient's time should be satisfactory. All the services provided to him while he's staying in the hospital, whether he's just coming to do health checkup or he's going to be admitted over a couple of days or a couple of months until he finishes his treatment plan. Third thing is the patient's rights. Patient's rights are very important. As you have rights as an employee in the healthcare system, your patient has rights too. Has the right to know his diagnosis, has the right to be involved in the decision making related to his healthcare treatment and plans, has the right to take decision regarding his treatment and plan, has the right to know all the alternatives for his treatments and choose what he thinks is best for him. After, of course, counseling with the healthcare team. Also, the healthcare services are now maintaining for high standards for patient care, getting accreditation locally and globally to advance the healthcare system. As a conclusion for our presentation today, I'm quoting some of the famous characters. In an emergency, what treatment is given by ear? Words of comfort. This reflects how important nurses is to have the power to comfort the patients and take care of their patients' emotionally and psychological needs. Another saying says, they may forget your name, but they will never forget how you made them feel. Nursing experience stick with the patients. If nursing services is good in a certain healthcare sector, they will always recommend this healthcare sectors to other people. And if the nursing services are not satisfactory, they will never recommend this sector for another person. The doctors may be mapping out the war games, but it is the nurses who make the conflict bearable. You are a healthcare worker, you're helping people live healthier lives, so you're basically a superhero. Lastly, I would like to thank you all for listening to my presentation. And please, if you have any question regarding nursing profession, don't hesitate to email me.